Well, we are going to continue the conversation, taking a look at the act of caregiving in partnership with Noora Health. But to kick us off, we would like to start with a short video that I'll ask our team to tee up and play, and then we'll continue with the conversation.
In the quiet, difficult moments of life, where love meets action, there exists something profoundly human, a subtle act of care. Caregiving is a universal act of love. It's the little and big things that we do to help each other. In those early mornings and late nights, hoping for recovery, a moment of comfort, or a future that's healthy. Yet amidst these gestures of love, family caregivers, often women and girls, face complex challenges and are met with isolation, financial stress, anxiety, and so much more. Now imagine a different world where caregivers are no longer taken for granted and where we feel confident and supported by the systems around us.
I think that tees us up nicely for this conversation around really the importance of family caregivers as part of our health system. To kick us off, I'd like to invite Edith, Elliott, and Dr. Syed Alam, both co-founders and co-CEOs of Noora Health, to come say a few words.
Kate, and thank you everyone, especially our distinguished panelists, for joining us on this special conversation about the power of family caregiving. I imagine everyone in this room has either been a caregiver or has been cared for by someone that they love, whether it be a parent, a friend, a neighbor, a partner. It is due time for us to honor and respect this deeply complex and personal act of care and to develop systems that better equip and support the people who help us heal.
When Edith and I first met and started Noora Health about 10 years ago, we were driven by the belief that loved ones and family caregivers were one of the most important elements of care. Yet, they were unseen and unsupported largely by health systems around the world. But when family caregivers are supported effectively, we've seen that their burden is relieved, but also the patient's outcomes improves. We've seen in our work that there's a reduction in newborn readmissions by more than 50%, a reduction in post-surgical complications by 70%. So as we all strive to meet the SDGs, we believe that there's tremendous opportunity to fill these gaps by better recognizing and supporting loved ones and family caregivers. And to that end, we're incredibly honored to have the visionary leaders here with us today to share their perspective and approach. Thank you.
Yes, thank you both. So I'll invite our panelists up to the stage here. We have His Excellency, the Honorable Mr. Budi Sadikin, Minister of Health from the Government of Indonesia. Thank you. And Dr. Anshu Banerjee, Director of the Maternal, Newborn, Child, and Adolescent Health and Aging Department at WHO. We have Mohammad Mamunur Rashid, Joint Secretary, Health Services Division, the Ministry of Health from Bangladesh. Dr. Neha Garg, Director of the National Health Mission and Mental Health Ministry of Health and Family Welfare in India. And Dr. Syed, Head Policy and Partnerships, WHO Special Program on Primary Health Care. So a real powerhouse group of experts here. Thank you all so much for joining us for this really important conversation. And I'd like to start with you, His Excellency, Honorable Mr. Budi. Under your Honorable Minister's leadership, Indonesia's health ministry has really started an ambitious health transformation across multiple areas. So can you talk about how you see supporting family caregivers as part of that transformation agenda?
So I'm in Indonesia. I'm a banker by 30 years. So I'm a nuclear physicist by training. So zero background in health. So you have to feel sorry for me that I'm sitting here in comparing with all of you. But let's get in the last 3 years. I only have been in this job for 3 years, and I have 6 months to go. I noticed that promotive and preventive is much more important, it's much cheaper, it's a better quality of life than if you wait until you need a curative programs. So that is my first belief. My second belief, when you want to do healthcare intervention, especially like in COVID, you cannot do it alone. You have to do it together. You cannot do it exclusively the program of Minister of Health. You have to do it inclusively. You cannot approach as a program. You have to create a movement. So that is the reason when I want to do the interventions related with family care, I realize the government structurally, we have 38 provinces, 514 cities, 10,000 districts, 85,000 villages, and 300,000 hamlet. Our national healthcare facilities owned by the government stop at the 10,000 districts. With my predecessor, great thinker of health. But I want now, with the healthcare reform that we are doing in the last 2 years, we want to push it down to 85,000 villages, basically owned by the government, run by the government. But I want to inclusively create a movement, not only put it at 300,000 hamlet, but to 68 million families. Why? Because I don't know in your country, but in Indonesia, the mothers it's very compassionate. I believe also all mothers very compassionate. They will take care of the husband when they're sick. They will take care of the children if they are sick. Even sometimes they take care of the dog and the cat when they are sick. And they never ask for any payment. They do it because of their heart. So if we can mobilize, facilitate, make all 68 million mothers of Indonesia not only understand how to handle fever, but putting a thermometer and give you a pill or syrup, or cough, they can give it syrup. They can pay doctors all the time, but only for three things: fever, diarrhea, and cough. If we can tell them, hey, this is the way you can put the hypertension, and if your blood of tension of your husband is about 130/90, you go to the nearest puskesmas, the primary healthcare facility, and they can give you free amlodipine. But you have to make sure that your husband consume that every day. Otherwise, you will be very, very mad to your husband. And I know every husband are afraid of their wife. So they follow. So the concept of motivating using the wife, 68 million, to be my first healthcare provider to families. I think that is a dream that I would like to do.
Well, I think you so eloquently put out there, you don't have to be a healthcare worker to be impacted by the need for caregiving. And Dr. Anshu, that's probably your learned that you should be here, so you're in the right place. You oversee newborn, child, adolescent health, and aging department at WHO. And caregiving really, it can start in the early stages of life and the later stages of life. And many families find themselves in that, sandwich generation where they're caring for young children, aging grandparents, all within the same household. So how does WHO prioritize caregiver training and support across all of these stages of life?
Thanks very much. And as you highlighted, caregiving indeed goes across the life course. And I think it's very important to realize that. One point I wanted to highlight actually also is the whole issue around gender and caregiving. Because what we see, particularly later in life, is that it are often most likely because they're very compassionate. But it falls on the women to actually provide care, whether it's care for the sick child, whether it's care for an older adult in the household, whether it's for their parents. And this actually also means that it is them who lose out of their contribution to economic growth of the country, but also for themselves, their own career, and potentially later in life also from social benefits. And because social benefits are built across the life course. And so if women sacrifice their career as they let's say, age and then are in a situation later in life when their husbands have passed away, their pension actually has reduced. And so it has also got economic impacts, I think, on women of being that carer throughout the life course, and it's something to look at. Often also, we know that it is the caregiver who needs care themselves. We have older women who are taking care of their older husbands, let's say, but they are already in need of care themselves, and who is there to provide that care to them? So there are a lot of, I feel, gender-related issues around caregiving that would be useful to highlight, and would be interesting to look at that from an economic cost as well. And so it's important in society that I think caregivers are both men and women, fathers and mothers, husbands and wives. And from that perspective, it's important to be able to provide them with the right kind of competencies in order to do that. So, for example, we're looking at, when it comes to child health, at the well child approach, and really looking at what does that mean? What is the role of parenting? And the COVID pandemic, of course, has also really shown what the role of parents can be in the well-being of their children. We've seen, situations of social isolation of children during the pandemic. We've seen that parents actually had to take on schooling at home because children couldn't go to school and be in classrooms in person. And so the role of parents, I think, has been elevated, or the parenting skills that they need to have become more visible during the COVID pandemic. So I think from that perspective, it's really important to see how to take that forward. And so from that perspective also, as part of the well child approach and nurturing care for early childhood development, as well as for adolescents, we're really looking at what is the skill sets, the competencies parents need, and how can we provide them to them in order to have, in order for the child to develop as optimally as possible.
I'd be curious, how many people in the room have served as a caregiver to somebody in their family? Yeah, I mean, it's almost the full room in the panel. So let's start, Mohammad Rashid. I'd love to hear about some of the challenges you face in your country of Bangladesh in supporting caregivers. And maybe do you have any examples of programs or interventions you've been able to deploy to help support caregivers who are often women, often underpaid, underappreciated?
Thank you very much. Actually, the COVID pandemic situation we have learned much more from the COVID pandemic situation, that only healthcare system, the routine healthcare system is not enough to face all the challenges. Rather, the multi-sectoral approach, the caregivers, the family and friends and brothers and sisters and their initiation, they are much more significant and helpful for the mental health. And we come to a better understanding that how much important the mental health issues in the pandemic situation. You know very well that our country is a 170 million population, and we are facing the challenges remaining the MNCs and MMR. And we have come to know a better understanding that in the COVID situation, those issues are very much addressed by the caregivers. And we have initiated some multi-sectoral whole of the society approach, from the civil societies, from the non-benefits organization, and all the issues come from the different platforms they have initiated in the COVID pandemic. And we have the whole of the government and the society approach. And we have come to a better understanding that the MMR rate and the MNCA's progress is much more better than we have expected. So the role of caregivers, the recognized how to integrate them in the healthcare facilities, how to integrate them the process of medication, process of caring, and you know a better understanding that only medication are not sufficient. Only medication you are giving the patient the medicines and all those supports are not enough. Rather, being friend, they serve as a friend and family member is much more important, and that's why our Ministry of Health and Family Welfare have included the caregivers and the representative as a member of the infection control national committee, and that was a very good understanding. And my insight is that to have a better understand how the caregivers can be included in the healthcare system, how their roles and engagement and what support they need are much more important to facilitate the whole of the society approach. And we have a better understanding also that their training and capacity building are very much helpful to benefit, to maximize the outcomes of the patients. So how to integrate all those initiatives from the non-governmental platform are much more important, and caregiver is growing a much more significant and important platform in the healthcare system. So far, I come to understand.
Thank you. And so, Dr. Garg, India has really lead the way in family-centered care. How do you think training and supporting family caregivers can play an active role in further achieving the SDGs? I mean, we talked a little bit about the undue impact on women, the even economic impact it can have. And what do you think others could learn from some of the work you've been doing in India on this issue?
Thank you very much. I would like to start with saying that, as His Excellency Honorable Minister of Health Indonesia mentioned in the beginning, the most important realization that the health systems across the world have had is that preventive and promotive care is definitely more important than curative. So in India also, we've seen that our move towards achieving the SDGs has happened more faster or in an accelerated way. Since the approach from facility-based or tertiary-based care has moved to primary-based care or community-based care. And from communities, I think it's very organic that the next step would be going to the families, where the caregivers are a big support system to any person who's suffering from a disease. And also in India, and also other countries with similar social constructs, families have anyway been the traditional caregivers. They've been the ones caring for people who've fallen sick. So it is only using a resource, giving them the adequate training and support that is going to help us in, of course, achieving SDG 3, which is for health and well-being. And the role becomes more important where the disorders or the diseases require minimal intervention, but more of adherence to established protocols that need self-regulation, so that there's someone who can discipline, someone who can support. So NCDs, reduction in premature deaths due to NCDs, is one major SDG where we see that the caregivers would have an important role to play. And of course, achieving targets for maternal and child health is another one. As mentioned, there's nobody like a mother who can take care of a newborn. And reduction in, as mentioned in the morning, reduction in newborn readmission rates has drastically reduced with the caregiver approach. So, but not only SDG 3, but also when we talk about women. So we were having a meeting of stakeholders for working on a strategy for autism. And we had a meeting with the family members. And the question was, where are the fathers? They were all mothers. And it is not that the fathers don't want to be there. It's just that social constructs are such that when faced with a stressor, the automatic response of a family is that the mother goes out of the economic system and the father takes care of that and the mother takes care of the family. So I think that in reducing gender inequality, of course, it has a huge role to play. because it provides it gives a balance to the caregivers, both male and female, to be able to do both the things at the same time. Then again, SDG 10, reducing inequalities. If we're able to bring healthcare to people at their homes, then the difference between haves and have-nots, of course, reduces. So I think caregivers have a huge role to play across SDGs, not just for health and well-being. Then coming to what can be learned from the Indian model. So India itself learns from India. We are such a diverse country. We have different states. And also for the companion caregiver model, we've had different models being followed across our different provinces. So depending on the disease burden there, depending on the particular needs, there are very various models which have been very successful. Evaluations have shown good results. So, and at the national level, we have also been learning from these systems. We now have a caregiver model for tuberculosis at the national level. So we are here to help anyone who wants to learn, to share our models, and at the same time to learn from others what we can do more and how we can take this further. Thank you.
Thank you. So, Dr. Syed, you head up policy and partnerships at WHO's special program on primary health care. How do you see the role of caregivers fitting into the broader primary health care system and approach?
So much, Kate, for that question. So first of all, just listening to all of the distinguished panel, there are so many different points that indicate the need for a primary healthcare oriented health system. Mm-hmm. And fundamental to that is, of course, point of care issues and clinical care, but also, and many colleagues in the room will know, the three core components of primary healthcare approach. So services, the engagement and empowerment, and the multisectorality. So within that context, we can see the power of family caregivers, but the health system, as colleagues have indicated, has a ways to go to be able to support those family caregivers in what they need to do. Second point that also may be highlighted is the critical importance of quality of care, whether that be quality of care delivered in a health facility, but importantly, the quality of care that's delivered in a household. And of course, as all of us know, health is produced in households. Health is not produced in facilities. And this is where the power of family caregivers really comes in. And then the third point really also points to the introduction that Edith and Shahed put forward, is you'll notice that they were talking about love, and deliberately so, I think. There's something there in terms of compassion that needs to drive the future health systems. And when we talk about compassion, we can talk about it loosely, or we can get into the nitty-gritties of what compassion means within the context of a health system. So the concept of being aware of human suffering, the concept of empathizing with that suffering, but importantly, not just leaving it at the empathy, but taking action to alleviate that suffering. And examples from family caregivers, I think, are some of the most powerful examples of where compassion is being delivered from one heart to another.
Yeah, and that can be so hard to quantify and maybe even hard to scale. And so, Excellency, I would love to hear how you think about some of these challenges in Indonesia and some of the opportunities when it comes to supporting caregivers, whether it be through training, whether it be through financial support, and how you think this can better enable a more compassionate and more effective overall healthcare system. Let's go ahead and.
I became a Minister of Health on December 2020, just at the beginning of the COVID. So the first time I read about SDG 3 is on June 2021. And I still remember that. My apology. Again, I'm a banker for 30 years. To promote healthy life and well-being for all people and all ages. One of the things I noticed, there is no such a statement called to cure sick people. And then I had my first G20 health ministers meeting in Italy. I think August 2021. I shake hand with 20 health ministers of Italy, health minister of Brazil, health minister of United States. I'm looking for a health minister with the title Minister of Sickness or Minister of Cure. I couldn't find any. So the point is, our job in the healthcare sector is to keep people healthy, right? Because it's mentioned in SDG, and also no health ministers have a title Minister of Sickness or Minister of Cure. And that is what I would like to propose to caregivers. It's not only handling the sick people, of handling after sickness, but your focus should be to keep your family healthy. And now we would like to do it in Indonesia. Indonesia, number one killer is stroke, 300,000 per year. No, that is the registered number. Actual numbers you multiply by 3. We are very bad in registering. Number two, heart disease, 250,000 per year. So I started with this one as an engineer. Let's prioritize in those two. Stroke, this is cardiovascular disease. You just measure the blood pressure. Now you have to go to the district level, 10,000 puskesmas. Now I'm thinking, how can I distribute, the blood pressure, devices to all 68 million households? It's not that difficult, to measure. If about 130 and 90, then the mother should push the husband to go to the puskesmas and get a free amlodipine. Second is about glucose. Diabetes in Indonesia is growing like this. That is also the cause of stroke and heart disease. What we are doing now, you have to go to Puskesmas, measure your HbA1c. If it's above 5.7, then you have to take metformin. Now we are thinking if we can send a POCT to every household, every mother, so can stuck the needle to the husband, scream a little bit, take the measure. If the glucose level is about 200, you get a free metformin in the Puskesmas. The third one is about the blood lipid. Now you have to go to Puskesmas, measure your LDL level is about 100, then you will take it, the statin, atorvastatin or simvastatin or whatever statin the doctors will prescribe to you. But now we are thinking, can we have a POCT that give it to the wife, and the wife can stuck again the needle to the fingers of the husband and measure whether the total cholesterol level is about 200, and send it to Puskesmas and ask for the statin. And we need to change the lifestyle of the family. Only the wife can scare the husband and scare the family. Hey, you cannot eat more rice. Your waist is above 90 centimeters. Your jeans is above 32. Otherwise, I will not give you any rice. And by the hell, you have to run every day, 30 minutes, every day, 5 days in a week, because that is a WHO standard until you die. So only the wife can do it. So that is what we are going to do in Indonesia.
Well, I imagine there are probably a few wives who wouldn't mind sticking their husbands with some needles, but I'll digress there. At our last moments together, I would love to hear from each of you just one recommendation you have for our audience, one thing you would like to see them take action on or think about as it comes to supporting family caregivers. And we'll start at the end with you, Dr. Syed.
Perhaps the one action is when we're thinking about family caregivers, let's think about that as part of a health system that is oriented towards primary health care and with compassion at the heart of that.
Dr. Garg?
I think that it's time that we realize that family caregivers are the backbone of the health system, and that is how it's going to be in the future, and we need to start working for that.
So thank you very much. You know very well that the Sheikh Hasina initiative for community clinic in Bangladesh, and there is a very, very great opportunity to engage the family caregivers to the community. You think of a pregnant mother in the heat waves running in the Southeast Asia, especially in the Bangladesh, and how much support requires a pregnant mother from the caregivers, his family or her family, husbands, as the Honorable Minister, His Excellency Indonesian Health Minister was telling. That is much more important. So it is time to recognize the family caregivers in the healthcare processes, healthcare facilities, so that they could come to a better understanding with the families, with the patients, and the community. That will be much more helpful. And another thing is important, how to engage themselves, what levels of family caregivers to engage in the healthcare processes. That is good. That is very much important. And the nature of the teamwork in which they are supposed to do, in which they are supposed to deliver the optimum outputs of the patient outcomes. That's are very much important. And the capacity building of the family caregivers, the patients and their family members are much more significant and important. So I think that these records, the policy support with the governmental platform, with the civil society platform, and all other people, those who are engaged in the healthcare facilities, the healthcare process, that is much more important. Thank you.
Thank you. Dr. Banerjee?
I was just thinking of innovation. So we know that when women are pregnant, they should have antenatal care. And so one of the innovations that was brought in was around group antenatal care, group ANC, whereby some of the messages and interventions that can be done in a group are provided to the group. But then the innovation that came out of that was that those group of future mothers would actually be a support group for during the antenatal care period, but also afterwards when the babies were born, and they supported each other in ensuring the child would come for immunization, etc. So I think support groups would really be important for in order to support caregiving, so that they can support each other. They know what their issues are, and they can step in when someone else is not able to do so, or remind each other of what needs to be done.
Excellent. Your Excellency?
I've been a CEO of the largest bank in the country for 30 years, managing the money and the wealth of my clients. I've been 3 years as a Minister of Health, managing the health of my people. Trust me, the best wealth is health. Thank you.
Well, thank you to our esteemed panel. Thank you to Noora Health. And we have several team members from Noora Health here. If you want to talk with them in one of the breaks later, I know they also have some goodies going around. But thank you all very much.